I came to the air ambulance service in 2004. Previously, I was director of Cancer Research Campaign, and I had a reputation as a top fundraiser. So, my core business was raising funds for charities and been very, very successful at it. And then I got a call from an agency back then in, say, 2004. Would I be interested in looking at what was then the Warwickshire and Northamptonshire Air Ambulance, who had started a service and have got a very expensive helicopter, but were not making enough money to sustain it. And they'd got themselves around about £300,000 in debt at the time that I came, and could I build a structure in there to make sure that they could afford to run that helicopter at the time. So I came in as a top fundraiser. I'm happy to say that I was able to raise the money for the organisation, got all the finances stable, and then grown it over the last 17 years, from one helicopter service, which was doing trauma and medical emergency response in Warwickshire, Northamptonshire, to now 2 trauma helicopters covering almost all of the Midlands, and then also the Children's Air Ambulance, which is a national paediatric intensive care retrieval and transfer service. So, it came as a job to make money, but actually it's developed over the years into becoming a force in healthcare, and a really good resource that is there now, not just to pick up people in a helicopter and take them to hospital, but actually to deliver healthcare at the scene, and actually now assist both the ambulance service and the hospitals with anything that we can. And I think we're continuing to grow that way.
I think that's really impressive of what you've achieved. And tell me something, do you come from a healthcare background?
No, I was Royal Navy when I left the school, and then I spent a few years in the civil service, which, with all apologies to civil servants here, I really could not have done that for the rest of my life, because it was just not exciting enough. So I fell into the voluntary sector accidentally, because I was raising funds for my 2 boys playing in their football teams, and I was doing a little bit for charities. And I just found that I was good at it. I found that I was good at raising money. And then the opportunity came to do it for a living, which at the time, this is back in the 80s, I didn't even realize you could do fundraising for a living. But I never looked back. I really didn't look back. And what it did is it transformed me as a person, if you like, from just being a fundraiser into somebody that became very passionate about making a difference to people and communities right across the country. And even with third world aid, or there was lots of things that I could get involved in and do, but the real passion came for healthcare, because you saw the difference you could make immediately. And by helping develop the air ambulance service, to switching from a swoop and scoop service, I would describe it, back in the early days, where helicopters would just come, pick up patients, transfer them to hospital and do nothing else. Actually, it became a doctor-led service. It became clinically led, whereby then we had doctors on board, we've got senior registrars and consultants on board the helicopters, critically care trained paramedics, and now we can deliver the pre-hospital emergency care and medicine right at the scene.
That's a really interesting point. Why do you think changing that model to a doctor-led service made a significant difference for the air ambulance in general?
Yeah, well, because it's the doctors themselves. As I say, we made sure it was clinically led on doing that. So I'm responsible for the business side of it, but I'm not a doctor. But I would trust in the doctors and say, if this is what they need to develop a care service at the scene of the accident, at the scene of the trauma, then it's my job to deliver that for them. And the doctors themselves determine the path as to, this is what we can do, these are the kind of treatments that we can deliver on scene. When it was just paramedic only operation, obviously paramedics are great, they can stabilize the patients, do all that, but there are a lot of procedures that paramedics cannot do, whereas doctors can do those. So it made sense really to transform it from just picking up patients to letting a doctor go out and treat at the scene, because that reduces time spent in hospital. It it could be critical in terms of what care they can deliver there and then at the scene. So it genuinely saves lives.
Saved the NHS, or how much money did you save the NHS per year?
Well, we save the NHS around £10 million a year now.